Well, hello again. This is part 5 of the petition to stop Minnesota from removing women from their breast cancer treatment coverage. This one is entitled The Violation. First one was the new BAB age discrimination standard, just in April of 2020. And this one is The Violation, systematic MABC age bias violated the 14th Amendment. And it violated it a lot more too. Now, age bias at every step informed all the actions of respondents. That's the Minnesota Department of Human Services and the Ramsey County Community Human Services. Below, against the patient and her spouse, and were just overtly wrongful age-based acts and violated the due process of law intended by this court in Goldberg versus Kelly and Babb versus Wilkie, and by Congress and the Minnesota legislature to protect against age-based deprivation during needed cancer treatment. Now, the Minnesota courts impermissibly, and we maintain corruptly, replaced the contested July 2016 termination with a new termination, July 1st, 2017, which was strictly age-based and purported to be what HSJ, that's Human Services Judge Longfellow's, recommended, but which defied the DHS order requiring new adequate notice. Respondents did this after the evidentiary hearing on the first termination, that's back in July 2016, and used the earlier hearing to uphold something they did later without the adequate notice. Significantly, the only reason they did it was her age being more than 65 at the time. The July 2017 final termination was just left there in place with no payments and numerous attempts, including to this U.S. Supreme Court, to reactivate her MABC benefits during treatment and on appeal have been uniformly shrugged off, all age-based. The order for a new appeal with adequate notice of what the county intentions and grounds were resulted in a second HSJ Nicole Kralik procedure being set up without jurisdiction, according to the Court of Appeals, but having the illusion of voiding the June 8th, 2017 order, which was to keep the payments in place and give adequate notice and have a hearing. Now, the main issue, we can't discuss on a petition for rehearing all the things that are discussed at great lengths in the cert petition. So you can't really get into a lot of this, but this is to show the applicability and how the BAB decision is going to work in protecting people against this kind of age-based discrimination. Now, the main issue of Kralik was a rumor she heard that petitioners were protesting and seeking a hearing contesting an age-based determination. But that termination occurred July 1st, 2017, and Kralik got involved more than a month later. So all that time, the payments which were to be kept in place were cut off. And she thinks it's a big joke. Kralik does. All right. Now, the county cut off all MABC benefits forever based on her age. Now, the second HSJ proceeding August 24th, 2017, 2 months after the final termination, was a charade and another age-based violation of the 14th Amendment, Due Process Clause, Equal Protection Clause, arbitrary and capricious. Now, these developments are relevant to the rehearing we seek for 2 reasons. One, they were entirely based on Victoria's age after November 11th, 2016. And 2, they consist of manipulation of the process to cover up the obviously unconstitutional, unlawful, reckless disregard and deprivation of federal protected interests in the entitlements of the breast cancer treatment program. As such, as in BAB, they called for the application of 1983, 42 USC 1983, in order to put her in the same position she was in before the age violations, that is to say, restore MABC for the duration of her treatment, and to provide for damages against respondents where that was impossible because of irreparable injury, and provide for prospective, injunctive, and declaratory relief against respondents. And remember, the county can be sued for damages because they are a person. Now, constitutional age-based violations. While respondents and the court below prefer a basis for their actions and determinations, which they say avoids a finding of equal protection age discrimination violations, they do so by invoking a right to infinitely more absolute cycle of age-based exclusion, denial, and discrimination, even denying the need for adequate notice of the grounds, all age-based, for a hearing ordered by HSJ Longfellow's recommended measures. Specifically, because of her age alone, in their stilted reading of an initial requirement, they manufactured the theory that she was no longer similarly situated to other women in the program with her, some who were, because of age, allowed to continue their treatment, and some who, because of age, were even allowed to complete their treatment as promised. Because of her age, in fact, respondents adeptly maneuver the 14th Amendment itself, as modified through some rational basis theory, to grant themselves immunity from the Medicaid Act, Equal Protection Clause, or Age Act liability. The only remedy is reversal in 1983. The government has applied a purely age-based dismissal of her clear entitlements to MABC during the time she requires the continuing cancer treatment prescribed by her doctor for her cancer. In fact, overly and overtly age-based, because the Ramsey respondents had to walk back their first 2016 age-based act, terminating her because for whatever reason they determined she belonged in, was eligible for, they say, an age-based MAEP program for the elderly with a huge and insurmountable spend down to get any help. Now, the age-based injury was severely heightened then because of Schweiker versus Hogan. That's a 1982 case in the Supreme Court, which respondents cited as justification of a punishing burden on Social Security recipients, imposing a punitive spend down to 81% of poverty, 20% below poverty per the household monthly. The court below says all that money is redirected to younger MABC patients. Under the Federal Medicaid Act itself, that's 42 USC 1936A3, which is about fair hearings. Congress also required Minnesota to set up a process for appeals and judicial review before terminating MABC benefits. Of course, the termination already occurred 2016, but the point is we did participate, as did BAP. Our administrative procedure should have protected us. We're going to HHS to complain about age discrimination, could not have done that. Nonetheless, the Age Act still applies to forbid any denial of benefits based on age unless expressly allowed. The government has not shown it is expressly allowed. The simple initial requirement, subdivision 10A4, with all the other parts of 10A, only initiates the treatment coverage program. The limitations period, 10B, completes the coverage if the treatment is successful, which we hope it always is, and they can actually get through the prescribed treatment. Okay, that is the end of this part 5.